Hello, everybody. Good evening. Today is Thursday. Holy moly, it's already Thursday. We made it through the week. Today is Thursday, February 29th. It is the leap day, which means tomorrow is the first day of March. And the reason why first day of March is special because it is considered to be Women's Month because there's International Women's Day, IWD, and there's also Ramadan. Okay, so Ramadan starts on March 10th or around there. I think March 10th or March 11th. I believe it's March 10th. And International Women's Day, I believe, falls on March 4th. Don't quote me on this, but I think it starts on March 4th. In any case, it is a really good month filled with a lot of goodies. And if you're a patient of Spinati Dentistry, there's a promo. So make sure you check your email. But nevertheless, what are we talking about today? We're talking about dental implants. And if you're considering dental implants, I am going to talk about why you should not get dental implants. This is not just clickbait, okay? But there are good reasons for you not to get dental implants. But you have to know what they are. And so what we're going to do first is we're going to discuss what the heck happens when you're missing a tooth, because a lot of us are walking around with a missing tooth or missing teeth, and we have no clue of the consequences, and it becomes a bit too late down the road when we're like, I wish someone told me, but no one did. I wish someone told me of what happens when I miss my tooth or when I lose a tooth. And now that I don't have my tooth anymore, I'm going to have to pay so much more than I would have if I dealt with it when I first started. So that's the first thing. The second thing is we are on podcast number 42, day 42, going strong as an ox. And let me tell you something. It is not getting easier. Excuse me while I wet my throat. So, yes, we're talking about dental implants. Today's podcast number 42, day 42. And March is a special month. And there was also something else I want to tell you that I'm probably going to forget to say anyway before I check, is that today's leap day. I knew I forgot something. Today's leap day, which means that if you don't take advantage of today, I mean, today's almost done, but still it's not done. So you can still do something. So invite some friends, have some party. So today's leap day means the next leap day is going to be in 4 years. So if you didn't plan this well, I'm telling you, you still got a few hours left. So it's 8 o'clock. You still have around 4 hours, 3 hours and 55 minutes left for you to do the final countdown. All right, let's get to it. Enough of me blabbing along. Check this out. Okay, I made this special presentation for you because, I care about you so much. I just want you to learn. And I see this so often in my dental practice that I thought, hey, you know what? Might as well do this podcast, especially dedicated to my peeps, to my fellows, to my loved ones. Yes, you're all my loved ones. But what happens when you're missing a tooth, and what is a dental implant, and why you should not get one if you fall in that category? There's a specific category of people that should not get dental implants. And so you should stay until the end for you to find out, okay, Dr. Spinati, we get it. Please go on. Okay, I will. Okay. Top reasons why you should not get dental implants. If you're missing a tooth, and many people say, it's not bothering me. So listen to this. Okay, just pay attention. Listen to this. Give me a few moments of your evening. It is leap day, so maybe make this the momentous occasion for you to celebrate leap day by paying attention to Dr. Spinati at Discover with Spinati when he's talking about a missing tooth. And this is important. Okay, I'm going to get to it. So let's see what happens when you're missing one tooth. When you're missing a tooth, first thing that happens, there are several things that happen. Okay, several. First thing that happens, you start losing bone. Okay, why is that a big deal? Why is that a big deal to miss bone, to lose bone? Because once you lose bone, you can't get it back. Yes, we do things called bone grafting and whatnot, but nothing's as good as your bone. So if you start losing bone, well, I mean, you're going to have to do something to try to preserve that bone as much as possible. And the best way to do that, to decrease your chances of a massive bone turnover or massive bone loss, is for you to put an implant in that bone. And that'll severely decrease the bone loss. So that's one of the things. And when you start losing bone, you start losing gum tissue. Okay. The gum follows the bone. Now, check this out. Look at this. The gum follows the bone, and then the teeth start to collapse. Look. So in this image here, you can see how, if you were to compare this image to this one, you can see how, the tooth in the front and the tooth in the back, whereas that in the middle of these two teeth, there's a missing tooth. Those two teeth adjacent to that missing area, that space, you'll see now when I click forward, you'll see now there's a space between that tooth and the tooth neighboring it on either side. So now there's a space there. And because the gums are receding, because you're losing gum, because you're losing bones, you're losing bone, therefore gum is going to follow bones. You're losing gum tissue. And then you're also now going to start getting the shifting happening. Now, with the shifting, not only do you get more of a space in between the teeth, which means now you have an increased risk of plaque retention. So now you have more risk of getting gingivitis, cavities, periodontitis. Now, you also have something called root exposure. Root exposure sucks. And the reason why it sucks is because once you get root exposure, it's incredibly expensive and very, very painful. So it's painful first, and then expensive, and then the pain of paying to pay it, to fix it. So what happens is you start losing bone, you start losing gum, and then you start getting the shifting of the teeth. You start getting bone exposed, the root exposed. Now, once the root gets exposed, the thing that happens is that you start then getting into a slew of problems. Now, check this out. What happens is that you get sensitivity of the tooth, because sensitivity usually happens in that area, okay, where the exposure of the root happens. Now, every time you brush your teeth, you're going to wear down that area a lot quicker than you will ever wear down enamel. As a matter of fact, enamel is almost not prone to wearing down with just a toothbrush. However, your root is not the same. So your root is going to have toothbrush abrasion, and it's going to suck because it's going to start eating it away, which then compounds the effect of a fraction lesion. And then you start getting sensitivity in that area. And guess what happens? Then you start getting much higher risk of getting root decay. You start getting cavities in that area because that protective mechanism, the reason why enamel, your white part of the tooth, doesn't get cavities so quickly is because it has such a structure that doesn't demineralize so fast with acid. However, the root's not the same. The root doesn't have that kind of protection. And so the decay on the root happens at a much higher rate and much more frequently than at the enamel, the crown level. So now you start having all these things, but that's not all. Okay, check it out. That's not all. Look what else happens. Oh, okay. This is an example of what's going on. So you see here, there's attrition. Attrition is where you get the wear of the teeth. Erosion. Erosion is where the teeth, because of chemical trauma. Abrasion is because of mechanical forces. And a fraction lesion is literally a combination of all, but it's specifically occlusal or bite trauma. And attrition is when your teeth are basically grinding against each other. So those are all types of traumas, but we're talking about the abrasion and the abfraction, not really the erosion, the attrition. Okay. Now, look what happens here. So I said that you get root exposure, sensitivity, root decay, you get abfraction, abrasion lesions, you start losing gum, bone tissue, you start getting spaces in between your teeth, you get more plaque retention, more cavities because of that, and you're more prone for all these other gum problems. And now you start having problems on the upper teeth as well, because now the upper tooth start to descend. So yeah, it says process called overeruption. So the tooth on the opposite side, whether or not it's on the top or on the bottom, it starts to super erupt. It starts to get out of the bone because it needs to contact teeth. So now you start having, just for emphasis here, then you start having root exposure on the upper tooth, or the tooth that's opposing the missing space. You start getting root exposure, you start getting sensitivity, you start to get food trap in between there, because now you have a big trap there because the tooth has descended. And now you start getting you're more prone to getting cavities there, root decay. It's a slew of problems simply because you're missing that one tooth. One tooth. Now, here's another thing that you'll start to experience as well is you'll start, I think I have this here. Yes. So your bone morphology completely changes, and now your force is directed at those two teeth because those two teeth now are holding what three teeth should be holding, right? Like, think about that for a second. If you have a table and you take the middle of the table out, okay, but you have the exact same force from the top of the table. Okay, let's say you have like, 3 basketball players jumping on this entire table. Okay, now you take the middle part of the table out. Okay, now you just have those two. What do you think is going to happen to those two parts of the table? They're going to crack eventually because you have the exact same force pounding on those two teeth when originally there were 3 teeth. So then you start getting fracture lines, and then you start losing those teeth, and so on and so forth. Then you start losing the teeth above because the teeth start to descend, and then they start getting loose. Bacteria start getting trapped more. You start getting periodontitis. It's a mess, but there's one more thing. Haha, you thought that was over. It's not. There's still one more thing. What happens is that when you're missing a tooth, you start biting more on the other side because it's not very comfortable to chew or to have food hitting your gums. Okay, ask anybody that's missing a tooth. They'll tell you, I chew more on the other side. So they chew on this side. Now, guess what happens? Because you're chewing on this side, now you have more force, more cyclical, repetitive force being put on that side, meaning now these teeth, the ones that you're chewing more on, now they're going to have a higher rate of fracture, even though you're not missing a tooth. And because you have more food in that area, you're going to have more plaque there, which means a more increased chance of cavities. Trust me, I've seen it so many times. Fractures, cavities, you're going to have a slew of problems of fracture lesions simply because all of this, by the way, is simply because you're missing one tooth. Now, if you're missing more than one tooth, obviously this compounded, it becomes a bigger problem, but then it just compounds over time. All right, Dr. Spinati, we get it. It's bad to leave the one tooth missing by itself, or it's bad to even have teeth that are missing because obviously you're sacrificing your oral health. All right. So it says here, you chew more on this side. On the other side, increased risk of cavities, gingivitis, periodontitis, fractured teeth. Now, what's an implant? What's an implant? An implant consists of 3 parts, and it's actually quite simple. It consists of 3 parts. It's the screw, the abutment, which is the part that connects the screw to the crown. That's it, 3 parts. It's not that complicated. Now, the science behind putting in the implant and, analyzing different kinds of bones and analyzing the bite and analyzing, where to put it and the anatomy of the nerves and, where exactly, what angulation should you put the implant in and what size and, what torque and all these things and what all these factors you have to take into account before you even plan a proper implant. Now, all that stuff goes into it in order for your dentist to put the implant inside your bone. Okay, so the implant itself, the concept of the implant is simple, but everything else about it is not. So that's what an implant is. Now we're getting to it. Why should you not? Shouldn't you? It says why shouldn't you get an implant? Now here's some good reasons. If you have uncontrolled diabetes, if you're a smoker, if you have periodontitis or poor oral hygiene, you should not get dental implants if you have any of those. So I'm going to recap. If you have uncontrolled diabetes, if you have poor oral hygiene, if you're a smoker, or if you have periodontitis, okay, any of those factors, I wouldn't recommend you get dental implants. The reason is because when you have uncontrolled diabetes, the healing is incredibly, incredibly low and slow. And the success rate of implants is low as well. Same thing with smokers. Smokers, what happens is that you get a constriction because of vasoconstriction of your blood vessels. And so you don't have a lot of nutrients going into that area. And because of that nature, you start getting more infections around that area because you don't have a good immune system or immune protection around that area. And so then you start getting a slew of problems simply because you're smoking. So whenever someone is smoking, as a smoker, I always tell them, I say, look, because you're smoking, the chance of that of the implant actually succeeding is low. You're going to have to think about quitting smoking before we place the implant. Or if you place the implant, you have to understand that the risks are incredibly high for it to fail. So if you have those things, and if you have periodontitis, it's the same kind of thing. So you have a lot of bacteria around your gums and around your teeth, and more than likely that contributed to the reason why you're missing that tooth in the first place. So it doesn't make sense for us to put an implant inside your bone if you have that issue. So that issue needs to be controlled first before an implant is placed. Now, periodontitis is a diagnosis of loss of attachment. So you have like your tooth is attached to the bone, and so you lose that attachment, some of the attachment, and loss of bone as well. That's periodontitis. So if you have that condition, it doesn't mean you cannot get dental implants. It simply means that that condition needs to be stable first before you start getting into dental implants. And poor oral hygiene, I mean, that's obvious one. If you are not brushing your teeth, you're not flossing properly, if you put an implant in there, obviously it's going to fail, because if your tooth failed and your tooth is a lot better than an implant, then obviously the implant's going to fail. Okay. And lastly, why you shouldn't get an implant. If you have a traumatic occlusion, and we don't really consider that very much. So let me talk about that. What I say by we don't consider that very much is that we don't talk about that enough. In that if you are placing an implant in an area that already has tooth that has descended or has ascended, depending on where the missing tooth is in your jaw, and you're putting an implant there, and then you're going to put a crown there, well, obviously that crown is going to get pounded to smithereens. Okay, so what happens is that bite needs to be balanced first. So orthodontics more than likely needs to precede implants. Orthodontics is, whether it's braces or Invisalign, clear aligners, that's placed in order for the teeth to get balanced again in a proper bite, so that when we put an implant, the implant can actually succeed. That's the whole point. We don't want to do any kind of procedures and then have them fail. Okay, because obviously the procedure is invasive and it's very expensive. So you want to protect that investment. And by doing that, you're also, think about if you get a car. If you get a car, you're going to get all this protection. You're going to protection for your tires. You're going to get coat protection for your paint. That's basically what it is. So when you do the balancing of the bite, you're protecting your bite. You're protecting your teeth. You're protecting your future investment. You're protecting the implant, and you're protecting your health, your oral health. Okay, so that's what the traumatic occlusion is. So if you have a traumatic occlusion, if your teeth are not biting properly, then putting an implant there, obviously it's not going to make the implant succeed. It's going to make it fail. Pathological disorders of the bone. So if you have any disorders of the bone, now obviously that's something that would definitely be diagnosed and would be looked at before any implants is placed. So if you have any of that, your dentist will let you know. And xerostomia, which means that you don't produce enough saliva, you have dry mouth. That also can and may lead to failure of dental implants, simply because the bacteria is not going to be washed away, and there's other problems as well associated with it. So today is, like I said, today is Leap Day, and that's it. That's basically it for today. I think that's it. Did I miss anything? See, thank you. There's a thank you slide. Thank you. Consult with Spinetti Dentistry if you're exploring your options of dental implants, and this is the email: info@spinettidentistry.ca, and that's the phone number. All right. That's it. So thank you again for tuning. Thank you again for those people that have been tuning in, who are started to tune in. I've noticed that a lot of you are starting to tune in more and more, possibly because they're like, man, this guy's so crazy. He hasn't missed a single day. Let me see what he's talking about. Okay. So thank you in any case for watching. But the thing is that I don't want to thank you in like as a sympathy kind of thing, because that's not why I want you to watch. I want you to watch because I want it to be I want it to be very informative and to a little bit entertaining. Like, obviously, I don't want it to be boring. I don't want to talk like this and be like, all right, so today is Leap Day, and we are talking about dental implants and why you should not be getting any. So make sure that you pay attention, because this is going to be the most boring podcast you'll ever listen to. No, it's not going to be like that, right? But that's why I put a lot of energy into it. I do this after work. So I prep for it. I do the slides, and then I show up with all my energy that is in me for you, so that you can learn and you can benefit from it. And I'm doing it at 8 p.m., Sunday to Thursday, so that you know when to show up, and you can go ahead and listen. Now, before I close, because I seem to do this too often, let me see. Let me see if there's any comments that I should be responding to. All right. So Omar says, best dentist in Ontario. Wow, that's great. Thank you. Can I join the podcast? Sure, you can. Sam, DM me, Sam. Dr. Spinetti is inclusive. Absolutely. I want to share my video. Yes, you can do that. Sam, DM me. I don't know what video you're talking about, but DM me. You need to ask the doctor. I want to hop on the podcast and share my opinion. Sure, you can do that. Multiples. You cannot have perspective because that is momental. Replace it with ivory. Yeah, that'd be good. Perio stage 3, grade C, get implant or get home. Panic opinion on guided tissue regeneration. This is not the podcast for it. Sure, it does, Sam. Better my periodontist or Dr. Spinetti. All right, cool. So that's it. Thank you very much. Have yourself a good night. Happy Leap Day. And let's start March 1st with a bang. Good night.